Bore da, croeso, welcome to today's meeting of the board, which is being held virtually and live streamed via the Health Board's website. It will also be available to view after the event. I'd like first to welcome any members of the public or the press who are viewing this meeting, and then also welcome to Health Board members and representatives from the Community Health Council. I'd like to start by introducing the participants. I have to say this morning's meeting is taking place on a particularly gloomy day as we face the sad news of 100,000 deaths in the UK having been passed. The weather is presenting us with a pathetic fallacy. It's deep gloom here and fog. So let's hope that things brighten up and we can look with optimism to getting on with work, you know, and really pressing on with the vaccination programme. So I'm Viv Harpwood, Chair of the Health Board. Also present is Melanie Davis, the Vice Chair, and independent members Francis Gerard, Ian Phillips, Mark Taylor, Susan Newport, Trish Buchan, Tony Thomas and Matthew Dorrance. Present also the Chief Executive, Carol Schillebeer, and the following Executive Directors, Hayley Thomas, Deputy Chief Executive and Director of Planning and Performance, Jamie Marchant, Director of Primary Community Care and Mental Health, Julie Rolls, Director of Workforce and Organisational Development, Alison Davis, Director of Nursing, Claire Madston, Director of Therapies and Health Sciences, Pete Hopgood, Director of Finance, Stuart Bourne, Director of Public Health, and Paul Buss, Interim Medical Director. We also have with us Rani Mallison, our Board Secretary, Katie Blackburn, Chief Officer of the Community Health Council, Francis Hunt, Chair of the Community Health Council, and colleagues from the corporate governance team who will be supporting us throughout the meeting. We've had no apologies. So please note that participants may look away from time to time from the screen to enable them to access the documents that they're speaking to. Moving now to the agenda, which is published on the website along with the papers. We do have a very focused agenda today, and I hope that we'll be able to progress the business of the meeting efficiently and conclude the meeting within a reasonable time, but allowing people enough space to ask the questions they need. To that end, however, we'll take as read the papers in section 4 on the agenda. So just to get on then with the business, are there any declarations of interest, please? No? Thank you. Can we then look at, we have a sort of suite of minutes that have yet to be confirmed from previous meetings. So could you turn to those, section 1.3 of the agenda, and we'll take first of all minutes of the meeting held on the 25th of November, way before Christmas, a month before Christmas. So that was held via Teams, virtually, like this meeting. You have had an opportunity to read these, and if there are any typographical errors, which some eagle-eyed people have spotted, would you please let the board secretary know rather than raise them here, unless there's something crucial like the omission of the word not, but I didn't spot that. So can we just take it that you have read these, and there are 22 pages of them. Did anybody spot anything that they thought might not be an accurate record of proceedings at that meeting? No, good. So can we take it that those can be signed off as an accurate record of the meeting? We will have an action log to look at the end, so I won't raise any other business on that and any other comments on that at the moment. Then the meetings of the extraordinary extraordinary meeting of the board held on Monday, the 21st of December 2020 via Teams. Again, same applies. You have had an opportunity to read those rather short set of minutes. Are there any comments? I'm not sure whether you can hear me. I'm not sure whether it's my screen that's frozen or it's happened at your end. Please indicate if they can hear me. No, well, I don't know. If I'm not audible, I'm going to have to ask Melanie to continue with this for the time being.
You can be heard, Chair.
Oh, I can, thank you. Right, well, my screen is frozen then, never mind. Are there any matters that need to be corrected in that set of papers? No, if not, then can we please record that they are an accurate record and deal with any matters that may be arising a little later. Not sure whether, yes, there are no more sets attached. So can we turn to the action log, and you'll see there that there are no actions outstanding, but did anybody want to raise any matters arising from those two sets of papers? No? Good, thank you. You'll see then that there are ratification of, I have also some minutes here, agenda item 1.6, ratification of decisions of chair's actions. Does anybody have any questions about those, please? As far as I'm concerned, they are a correct record. I'd like everyone to be happy about confirming that for both of those sets, the 8th and the 14th of December 2020. Are there any matters arising? No? Okay, thank you. This is good. We are getting through, but please do feel free to raise anything if you are concerned that something has been omitted or things are amiss. Good. Well, I'll continue with my report, which I'm presenting orally today, again in the interests of saving time. It goes without saying that this has been a very, very busy period. You've already seen the details of the chair's actions, and in view of the pressure of time during the pandemic, the only matter on which I propose to report is the important news that we have interviewed for the independent members' posts. We had some very good applicants, of whom we selected a short list of 6 people to be interviewed. And I'd like to thank Carl Cooper for his help with the interviews. I'm pleased to report that we have made some recommendations to the Minister, and we hope to have 2 people in post as soon as possible. However, we do have to follow a process which I'm afraid can take rather a long time, particularly at the moment when the Minister is very busy indeed. Things have to also to go through the public appointments unit, so it's not something that can be done overnight, but I do hope that we'll have our full number of independent members very, very soon in place. I'd now like to hand over to Melanie, the Vice Chair, to present her report. She has presented a written report, so thank you, Mel, for that. I hope you've all had an opportunity to read it.
Thank you. I'm just going to say that, a bit of feedback. Could the independent members please contact me about the WASC link that's in the report so you can read that, and also please note the Experience, Quality and Safety Committee's Maternity Service Assurance Framework, the Ombudsman report within that, and also the Clinical Audit Programme. If you could just focus on those, and if you come back to me and be assured that they will be coming back to committee next week. Thank you, Chair.
Thanks, Melanie. Carol, Chief Executive's report.
Thanks very much, Chair. There is a couple of things that I just wanted to refer to in this update. You said at the start of the meeting that yesterday was a very sombre day in terms of 100,000 people in the UK sadly losing their lives to COVID, and I wanted to recognise that people in Powys are sadly within those numbers, and there will be families, friends of people here in our own communities. So I did want to sort of underline that that was a very important and grave point really in the pandemic. Most of my update does actually cover the pandemic, so just to say that the COVID case rate within Powys positively has been falling. Not as quickly as we would all have hoped, I'm sure, and we all recognise from reports in the media the issues of new variants, etc. But nonetheless, it's important, I think, to recognise that the efforts that are being made by people in terms of the restrictions to people's lives are actually having a very helpful in helping to reduce the case rate here in Powys. I did want to flag the pressures in the NHS. We know that through the media pictures, certainly in England and in the London area, services have been under a huge amount of pressure, and people talking about, you know, days and weeks before being overwhelmed. I do want to recognise that that is affecting our colleagues across the border and the English trusts that provide care to Powys people, and in South Wales as well. And whilst the position has been stabilising over recent weeks, it is important to note that the NHS in Wales, as in England, at this stage is largely focusing on that urgent and emergency care, and I'll come back to planned care in a moment. Here in Powys, we are maintaining a strong response under the Unscheduled Care, Urgent and Emergency Care Service, and we'll get an opportunity to touch on that later. We have a very exciting agenda coming up, which is the vaccination programme, and I know that we'll be wanting to focus some detail on that. But I did want to mention about planned care, noting from the previous minutes the local options framework that the Minister for Health and Social Services published back in December. Work has been undertaken to ensure that we are able to respond to increasing pressure, be it in unscheduled care or be that in the mass vaccination programme. And as yet, although a significant formal redeployment of staff hasn't happened, we haven't yet made that decision, we have undertaken the baseline work to understand where we would be able to move staff from and to, but we haven't activated that. I just wanted to lastly thank colleagues across the Health Board and partners, both in particularly in primary care actually, but also in local government and in the voluntary sector, as well as our partners who provide care to people of Powys. And importantly to members of the public for trying their very best to adhere to the restrictions that I know that everybody will be fed up of at this stage, but maintaining those restrictions, doing our very best, is really having an impact. And Chair, we had the opportunity to thank a broad number of people, a bit more personally, although it was digitally, just before Christmas in a recognition event for staff, not quite in the usual way that we would have done, but nonetheless it was very well received. So thanks to colleagues for everything that they continue to do. And there's a number of papers there, Chair, that we can pick up in terms of some of the detail of the COVID response as well. I'll leave it there. Thanks, Chair.
Thank you, Carol. Before Hayley's report, I wonder, would you like to say anything else, Carol, about the vaccination programme? We have been receiving regular briefings as board members, and also with our colleagues in the local authority have been kept very well briefed, as well as being involved in it themselves, of course. So was there something you wanted to just say by way of introduction?
Yeah, if I may, thanks, Chair. And Hayley will lead the item and take us through the detail of the plan and the slides. But I just wanted to say how important this programme is for us both personally and professionally. I know as a board, as you say, we have had briefings on this as the programme's been developed. But I particularly wanted to take the opportunity to thank everyone that's been involved in establishing this programme. We have had a really good start in Powys. The scale and the pace of this programme is huge. There are lots of challenges. We asked people to be patient with us, and they have already been patient with us. But I just wanted at the start of the item to mention that thanks, and that's both in terms of directors. So individually and collectively, directors have put a lot of work into this. Their senior managers, their clinical teams, but also our partners as well. So this is very much a collective effort in vaccinating the people of Powys, Chair. And so I just wanted to make those introductory comments before we went into the detail of the delivery plan. So thank you for that.
Thank you. So over to you, Hayley, then. Please go ahead. I think you've got a presentation there for us.
Yes, thank you, Chair. Diolch Cadeirydd am y cyfle I gyflwyno cynllun brechu Covid yn Mywys. I'll be presenting the latest version of the COVID-19 vaccination plan for the board today. As a start of a 10, I just wanted to say that this is a live document, and it needs to be a very agile plan because we are continuously reviewing continuous guidance from both Welsh Government, Public Health Wales and also the UK Joint Committee for Vaccination and Immunisation, and I'll be referring to that committee as JCVI during parts of the presentation. I just wanted to start first of all just the current position of where we are now with the vaccination programme. And the position's already changed since the latest data that was pulled off on this presentation at 6 o'clock last night. So as of this morning, we have had a really positive start in Powys. We have vaccinated 16,681 people, which is a really good start, and we're making headway towards delivering sort of against the key targets set within the National Vaccination Strategy published by Welsh Government. We have 3 mass vaccination centres in place, and all our 16 GP practices have started vaccinating this week. And again, this morning I've had latest figures that primary care have already delivered nearly 2,500 vaccines this morning. So we're making really, really fast progress with the primary care programme, and really appreciative of all the work that they're doing to support the rollout in Powys. There's a very clear target in the plan around making sure that we prioritise care home residents and staff by the 31st of January. And again, we're making really excellent progress with nearly every resident of a care home and staff who are able to have the vaccine. There will be some who have been too unwell or who have had a positive test result during this period. That means that we'll have to have them come online a little bit later, but again, making really good progress. And we have now been sending invitations and appointment letters and telephone calls to the cohorts sort of 1 to 4, which is really people over 70, and we're continuing to try and get the appointments out for the clinically extremely vulnerable category as well. And to date, we've had nearly 5,000 of the over 80s who've already been vaccinated, and we've got plans in place to make sure that we continue to make progress over the next 2-3 weeks to deliver against the mid-February target in the plan. There have been some challenges to the programme, and obviously our geography and rurality has been one of the things that we've been trying to make sure that we've got an offer that brings it as close to home to people as possible. And we've also got a really important fact. Our demographics in Powys means that for us, in those first 4 cohorts, we've got nearly 40,000 people, and that sort of accounts for around about 33% of our population. So it is a significant number that we need to get through the process. I'll pick up a little bit later in the detail of the plan around some of the factors around vaccine supply, storage and logistics, and I'll also pick up the significant amount of work that the organisation has had to do to scale up our booking and appointment system. But before I go into sort of the summary of the plan, is that this effort is absolutely a Team Powys effort, and you know the work that we're doing in partnership with the County Council, with PAVO, volunteers, the third sector, the military and other key partners has been absolutely key in helping us to work through and deliver this quite significant programme at scale and at pace within Powys. Okay. The next slide just sets out the detail of the milestones within the national strategy. And as I said earlier, we have got 3 key targets we're working to at the moment. For this Sunday, the position around care home residents and staff. By mid-February, the offer to cohorts 1 to 4. And for that, that's about 88% of preventable mortality when we're able to prioritise those populations. Sorry, the doorbell's going and the dog is barking in the background, so I'm really sorry, I'm distracted and nobody else is here to answer it, so apologies. And the third element is the target around cohort 6 to 9 by spring, and again 99% of preventable mortality will be achieved when we're able to provide that to the population. Sorry, the joys of working from home, I'm so sorry. Okay, on the next slide, we're setting out the programme aims, and I just wanted to highlight 2 key issues really. This is a very fast moving programme, and clearly we've got to get, our key aim is to get as many people vaccinated as quickly as possible, as safely as possible. But just need to reassure that we have got a principle of ensuring that no one is left behind. So I'll be picking up a little bit in the plan around what we're doing and our plans around ensuring that some key groups are also included to make sure that if they have more difficulty in accessing the vaccine, we're able to support that. Somebody's very intent on me answering the door, sorry. Okay, so the next slide just summarises really the vaccine supply and regulations, the clinical and operational teams and what they've had to work through to develop the right clinical procedures and protocols, guidance and operating procedures over this period has been significant. And you know, I'd like to thank the whole team for wrapping around this. The strict regulations are really important, both in terms of how we sort of receive the vaccine and how we store the vaccine. And there's been a lot of work we've had to do to make sure that the environment and facilities are appropriate. And people may not know this, we've also had to ensure security arrangements are checked, counter-terrorism checks, etc. So significant amount of work being undertaken. Carol's mentioned earlier in the introduction, we have had some bumps in the road and some issues we have to deal with in rolling out a programme of this scale. But I'm really pleased we're a learning organisation and we've got a very, very good way of identifying issues as they happen, and also a very clear process to ensure that we take lessons learned so that we're able to avoid similar issues happening going forward. I mentioned before around the JCVI and the prioritisation framework is really helpful to us, and we've been working through in partnership through the national programme to make sure that we have a shared understanding of what that means, and in particular with our county council colleagues we've been working very closely to make sure that we are ensuring that we're following those priority cohorts, recognising the preventable mortalities in those first 4 cohorts, and we need to prioritise them. In terms of the vaccination delivery model, then this is quite a busy slide, but just wanted to highlight the 4 key components of the plan, really. So our very clear offer is around mass vaccination sites, and the reason for this is it gives us the ability to use the supply of Pfizer, which is a guaranteed supply, in the most effective and efficient way. And those 3 mass vaccination sites now are very well established. We shifted the location in Newtown to Maldwyn Leisure Centre, which is excellent because that's doubled our capacity. And you'll see from that and the detail within the plan that we've got a baseline scenario and then reference to surge scenarios. But I just wanted people to be aware that this is a moving, flexible option which is often used. So the baseline workforce is calculated on the basis of a certain amount of vaccine supply, but where we've had additional people, we've been able to identify to come in line with the prioritisation, as well as making sure that we've got good flow through the mass vaccination sites. We've been able to flex up and down the lane capacity as we need to make sure that patient experience is the best it can be when they come to our mass vaccination sites. I've mentioned before about primary care and the 16 GP practices. I also wanted to mention that we are in discussions with community pharmacists as well. And we have had expressions of interest, and this may be something that we'll be able to deploy at a point in the mass vaccination programme, but at this stage we're in the scoping stage because we would need to identify additional vaccine supplies in order to support that part of the delivery model. But it's really, really positive that we've got a very forward-thinking cohort of community pharmacies that want to participate in the programme as well. The mobile provision end is important, so we've been going into care homes to deliver the vaccine, and our district nursing, our specialist nursing, our community nursing staffing have been absolutely excellent in getting the vaccine to those most in need, and we've done that both in the setting of care homes. We've done it for people, we've started to do it for people who are housebound. We're continuing to do that on a day-to-day basis, and also we've ensured that our inpatients have also had an opportunity in our community hospitals to be vaccinated. And the 4th component, not by far the least component, is there's an awful lot of logistics that goes behind being able to deliver a programme at this scale, and in particular, Pete leads a lot of this work, but I think the clinical logistics work has been significant. The work around our sites and getting them up and running has been very important, and then the whole process of booking, administration and information is a continuous work stream, which is very, very busy. So I think that sort of describes broadly the different components of our model. And then the next slide sets out the geography and the sites. And this is the challenge that we've got in Powys. But I just wanted to reference 2 issues really with this, is that we don't have a tidy population in that equal levels of population in different parts of Powys. You'll see on the left-hand side, we've got a significantly larger population in the North Powys area that we need to vaccinate compared to the mid and the south. And that's why we've got to be having a very flexible approach around where we put the additional vaccination capacity, either in our mass vaccination sites or in primary care, or by any other means, to make sure that we're actually getting through the cohorts as we should do in order at the same time. And I think that personally, this offer, you can see for Powys, means that for those who really can't get to a mass vaccination site, that offer is available now in the GP practices, but we are still really encouraging people who can to attend the mass vaccination sites because of the guarantee of the Pfizer vaccine and the ability to make sure that we get most of our population vaccinated as quickly as possible. The next slide is a very summary slide of the detail of the key programme arrangements we've got in place. Just wanted to highlight a couple, if that's okay. Workforce, without our workforce we couldn't do this. They've been exceptional in how that they've made themselves available and how they've engaged with new training and competencies to actually be able to deliver this programme, but also generally how people are just pulling together to make sure that they're available and delivering the best patient experience when people are arriving for their vaccine. And we have had teething problems, it would be fair to say, but we've also had really wonderful stories back from our patients when they've attended the mass vaccination sites of the quality of the care and the attention and the experience that they've had when they get to be vaccinated. Volunteers, I'm going to mention again, we have got an army of volunteers that are supporting us to deliver this programme and really couldn't do it without them. So again, huge logistical challenges, and very grateful to PAVO for their support in both recruiting and supporting the volunteers, and also to the workforce team for the work that they're doing to just simply coordinate the rotas and the shift patterns and making sure we've got the right people in the right place during this delivery programme. The other area I'd pick up is around booking and documentation. Again, we are working tirelessly, and the team have, with Powys County Council, we've changed our telephony arrangements. Yesterday, went live at 9 o'clock yesterday, and you know, we're working as we go along to make sure that we are building capacity and trying to address any teething problems that we've had around booking and administration at the start of the programme. And it would be fair to say that we're having a lot now of sort of positive feedback around some of the mechanisms we've put in place around managing, for example, the adverse weather we had, around how people can cancel appointments and rearrange, and some of the flexibility we've put in place to try and identify a reserve list to be able to handle if people can't on the day attend an appointment. But I just wanted to reassure the board, the reserve list is for those people who are in cohorts 1 to 4. It is not a generic reserve list. We're still following the prioritisation process around managing the reserve list. And then finally, just in terms of communications and engagement, again, very heavy workload to make sure that people are aware of the services, how the programme is being delivered, and also to allay some of the concerns and fears people have, and to get the right information out. That's been a significant amount of attention that's been undertaken over this period of time. The next slide sets out this inclusive approach when I said we don't want to leave anybody behind. So we are undertaking steps at the moment to do some analysis work to see about uptake and whether there are particular groups that we need to focus on going forward. We've highlighted some of the issues that we've got around rurality, transport and perhaps distance that might be a barrier for people to attend. And we've been working with the council and with community transport providers to make sure that we can put that support in place. We've also got particularly sort of populations that we might have to work on more to actually increase uptake. Some examples of that would be the homeless or perhaps gypsy traveller communities. So we're aware we might need to do some further targeted work to help people to access the vaccines. And we've also been working very strongly on cross-border arrangements. So we're really clear of the arrangements that we've got and clarity around those arrangements with our cross-border partners in England. So and we will work to find solutions, to find ways of getting these people vaccinated if they're not coming through the normal mechanisms that we've got in place through the mass vaccination sites and the GP practices. The final slide, I'm not going to cover in much detail, but just to reinforce that we have a surge capacity modelling for how we're going to manage first and second doses during this programme. And, you know, it is very important to note that we have got more capacity, physical capacity that we could deliver, but we have got to also secure additional vaccine supply to be able to make that happen, and we're in ongoing discussions with the national programme around the pace of delivery and what we can do to potentially surge up that capacity to be able to increase our coverage as quickly as possible. But clearly that national decision has got to also be considering how that is covered from an all Wales perspective. But we have been very supported, and we've been very lucky really. The Pfizer Powys in particular come in 975 doses. We can get more doses out of it now, but that means that you know, we've actually had a good amount of vaccine come through to Powys already, which has been really beneficial. And the final slide is just to remind some public messaging, really. Please, people, attend the mass vaccination centres if they can. That would be really important for us to get people vaccinated as quickly as possible. And some reinforcement that even after you've had the vaccine, the hands, face, space message still needs to be reinforced through our channels, and also that we are now sending the appointments out. So, you know, asking people to wait to be invited to their appointment, although clearly if people haven't had that invitation, we are dealing with those issues proactively as well. So that's a quick summary. Chair, sorry, it took a bit of time, but thank you.
Yeah, thank you very much. We are asked to approve this, so we need to have a full presentation. Before I go on to ask whether we will approve it, could I invite people to ask any questions or make any comments, please? I can't see any indication from anyone, so I
think Councillor Matthew Dorrance wants to ask some questions, Chair.
I can't see that in the chat bar, but Matthew, go ahead if you have any.
Yeah, thanks, Chair. Much appreciated. Firstly, congratulations, really. The way this has been stepped up in a really short period of time and building all the infrastructure around it is nothing short of inspirational, really, and just shows the willingness and the devotion to the NHS from all the partners that you're working with. I think it's inspiring. But that said, there will inevitably be questions and teething problems with anything of this scale, and it's right to ask. And I just wondered whether you could detail more about the transport plan. It is an issue that I'm aware of for people, and I was incredibly hopeful that the rollout of vaccination through clinics at primary care would help alleviate some of the transport issues of people getting to the mass vac centres. And it's not a criticism of the centres. I understand why you've had to do it that way completely. But for example, in the community where I live, the GP surgery is delivering its clinics through a satellite service at Senny Bridge, not Brecon. So therefore the transport issues, if you can't get to Bronchley, still exist, because how do you get to Senny Bridge? And I'm not clear as to what the transport plan is, or what the pathway is, or if somebody who's scheduled for vaccination at either of those venues actually gets access to transport. And it would be good to have some explanation about that, but also to how we can work with partners, maybe to be able to step something up more locally in that community, because it's a decent sized population base where we will inevitably need to vaccinate people. And just, you know, what makes this stand out for me as an issue is what I read in the following paper that we'll be considering, where it talks about socioeconomic status, and says that the report Transport and Exclusion, Making the Connection, Social Exclusion Unit 2003 highlighted the current challenges faced by socially excluded groups in accessing health and other services. And I just think that, you know, we'll consider that in the next paper. We need to understand it and put it into context in this one. And the other thing I'm not clear on, and I just would like some clarification, is about the reserve list. And I think that's great, that, you know, that'll help with the zero waste strategy and get more people vaccinated quickly. All credit to you for that. I think is fantastic. But I have had some questions about people who've been shielded and classed as clinically vulnerable, as prescribed by the CMO, that can't access that reserve list because of their age. And I just wonder if you could provide some more detail about that. I think it would be helpful. Thank you.
I'm very happy, Chair, to pick up a couple of those things, and then for Hayley or other colleagues to add in, if that's okay. First of all, thanks, Matthew. They're all really important issues. So just to update on the transport, we've been really mindful that whenever we talk about the provision of services, whatever services they are, we know transport is always a big issue here. We have had a proposal, and we've agreed that through our Executive Goals Command structure on a transport scheme with Powys Association of Voluntary Organisations as stage 1. So that was approved just a few working days ago. We will be doing some more communication comms through local county councillors, town councillors, and through our usual voluntary sector networks, including community connectors, etc. We are looking at the standard letter that goes out from the All Wales system to see if we can add in some more sort of Powys specific information, so that gives another opportunity to make people aware of that. And that will need to apply not only in relation to the mass vaccination centre, which you rightly raised, but where GP practices have put their centres, their vaccination centres, where people will need to travel to. So if I can just pick up, I know the specific issue around Brecon has been the need for the practice to try wherever possible to maintain normal GP access, normal GP services to the people of Brecon. And so their determination to use Sennybridge as the vaccination centre. And what a lot of people don't actually know until they experience the vaccine itself is that we require a 15-minute observation period after the vaccine. So it's not quite like the flu vaccine where you go in, you have it, and then you can leave straight away. So there is a space and a planning issue there. I think your point about socioeconomic issues has been at the forefront of our minds, particularly around a couple of our really key communities. And I can cite, Ystrad, Brecon, some parts of Llandrindod, Newtown, etc. And Hayley mentioned when she had the slide up about flexible options and mobile options. We've absolutely got that in our minds, and as we receive the I call it surveillance data, the uptake data, we will be able to see potentially where uptake might be less, and the areas of socioeconomic concern to us will be at that top of that list in terms of whether we need to supplement the existing offer. So there'll be more on that, and I think as this programme moves forward, as a board, we will want to pay particular attention to whether we are reaching our most deprived communities, who of course been more impacted by COVID. And then just finally on the reserve list, yeah, it's been very well received, the reserve list, but there are some nuances with it, and the clinically extremely vulnerable are people who have really significant underlying health conditions, and as you said, are in the sort of shielded category. We have asked our GP part of our programme to prioritise the clinically extremely vulnerable, and primarily we've done that because it is very often the GPs that know very well the individual patients and will be able to advise on the specific aspects of the vaccines in relation to their own personal underlying illnesses. So we haven't been looking to draw in clinically extremely vulnerable into the mass vaccination centre. Hayley has said that we're keeping it pretty fluid, so we're seeing how this goes. It's only the first week of the GP service. They've already done a fantastic job. So we do envisage that the people who are in that shielding category will be seen really soon, but we will keep an eye on that. I think we probably just need to explain that a bit more, because I have had an email myself from somebody who's asked that very question: why can't they go on the reserve list? So that's the rationale at this stage. But as I say, Matthew, we're learning as we go along, and we need to adjust where necessary. So I hope that's helpful. Sorry that it was a rather fulsome explanation, Chair.
That's fine, thank you. Does anybody else have a comment or a question? We have been fully briefed on this as board members. So there is one question that I would like to ask. I won't take up too much time because I know the issue of consent to treatment is fully understood and embedded across the whole of the health board in Powys. But could you just give us the assurance that for people who are unable, because they lack capacity to consent, unable to consent for themselves, all the necessary arrangements are in place? I don't know, Hayley, if you want to take that, or Carol.
Yeah, I was wondering actually, Chair, if one of the clinical execs, because there's been a huge amount of work with the care homes, as Hayley indicated earlier. So, and maybe Alison would like to offer a comment on that.
Thank you.
Thank you very much indeed, Chair, and Carol. Yes, of course, thank you. A really important question. Obviously, we're highly mindful of the need to make sure that we garner informed consent for anybody who receives the COVID vaccination, including our residents who are vulnerable and perhaps not able to provide that themselves. There's been a great emphasis on ensuring that we have safe practice and that we gather that consent in an informed way that takes into account the requirements of the Mental Capacity Act and best interest assessment, Chair. So our safeguarding team, working really carefully with our service group colleagues and colleagues in care homes, families and residents themselves to make sure that we do that. Generally building on the good practices in place in relation to garnering consent for flu vaccination at all other times. We've got an audit process in place, Chair, and very mindful of the need to make sure that we are practicing lawfully and ethically in this area.
Yes, thank you very much, Alison. I just feel that that's particularly important because of the not only the care homes, but people living in the community. And I was pretty sure, you know, the health board would be on top of it from my own experience and knowledge of the way the work is being conducted. But this is an additional time-consuming factor. So I'm very, very reassured by that. Thank you.
Thank you.
So if there are no further questions, can I ask you?
Sorry, Chair, I think, sorry, Chair, to interrupt. I think Trish and Susan wanted to ask this question.
Yes, thank you. I'm unable to see those in the chat bar for some reason. Please go ahead, Trish first and then Susan. Thank you.
I think Matthew picked up most of my queries. My only other comment, well, certainly I'd like to comment on how well the feedback I've received on the vaccine rollout has been, but could you clarify the situation where people over the age of 80 haven't received an invitation? What's the mechanism by which they seek help and get booked in?
Yeah, thanks very much. And Hayley may want to comment, but so I know that members of the public may well be watching this meeting. So all people who are over 80 should now have received an invitation. If they haven't, there is a form on our website that they can just fill in. It's pretty straightforward to say who they are and where they live, and we'll get in touch with them to check that we have indeed sent them an invitation, make sure all the details are right. The key intent is that no one is left behind here. So if people in the over 80s category have not yet had contact from us, please do get in touch with us and we will follow that up. And we'll do the same, Trish, as we move through each of the categories to make sure that we are contacting absolutely everyone. And that's the aim, but please do get in touch with us and we'll follow that up.
Is there an alternative mechanism for people who haven't got access to computers or don't feel confident to use it?
If they, and Hayley mentioned telephony, we had some really difficult issues the first couple of weeks with the volume of calls of huge numbers of people. I think we had something like 15,000 calls in a day asking about when they were going to have their vaccine. That's definitely reduced now, but we've improved the telephony through partnership with the local authority, so people can ring us and it will pick up people will pick up a call if people would prefer to make a call rather than fill in an online form. The forms are pretty straightforward, but I know that that's not everyone's choice.
Thank you. You're happy with that, Trish?
Yes, that's fine. I just think it's important people know. Thank you.
Yeah, there are all these logistical difficulties that are bound to be, you know, raising their heads from time to time, and it's great to see that we do have plans in place for dealing with them. Could I ask Susan to come in then?
Thank you, Chair. As a clinician and representing staff, I just wanted to inform the board that I've witnessed such teamwork, and it's been tremendous. There's a lovely atmosphere in all of the mass vaccination centres, all grades of staff working together 12 hours plus, and it's absolutely wonderful. And I know that the members of the public who have attended have been very, very grateful. My question is that, recognising that carers can fall into any of the categories, age groups, vulnerability, as well as obviously those that are in the first few categories, will they be able to access the vaccines under the no waste policy?
Thanks very much, Susan. So carers are in cohort 6 of the JCVI guidance, and Hayley mentioned the need to adhere to that guidance is really important, because we're trying our very best to make sure we reach the most vulnerable first of all. We have taken a reasonably pragmatic view, and I'll just give you a scenario where someone is a full-time carer for an elderly relative and is unable to leave them on their own to then attend for an appointment. So there have been occasions where, for those very pragmatic and in personal circumstance reasons, we have vaccinated carers at the same time as they're cared for. But that is more in the exceptional circumstance, because as I say, cohort 6 really is the carers element. We are working, as others are working across Wales, on how we make sure that we can capture the contacts, the names, the identification of carers, ready for the phase that happens just between February, then mid-February and spring. So that's the main cohort, and of course we'll have reserve lists when we get to that stage as well, Susan. So we're updating our information for the public weekly. You'll see on the slide there that there's a weekly newsletter, so we can add some of this information into those newsletters so that people are aware of them. So thanks, Susan, and thank you for your comments. I have seen you working in the Mass Vac Centre, and there's a huge amount of pleasure, I know, from the teams that are delivering this programme. Thank you.
Thank you, Carol.
Thank you very much. Is everyone happy then to approve the COVID-19 vaccination delivery plan phase 2? I can't see any dissenting comments, so we can take it that people are. So thank you very much indeed. And that brings us then to the next item. Again, it's Hayley who will present this and speak to the paper that she has submitted about the proposed changes to vascular services in South East Wales. So over to you, Hayley.
Thank you, diolch Cadeirydd. Mae'r papur hwn yn gofyn am cymeradwyaeth y bwrdd i gyfnod o ymgysylltu ledled y rhanbarth a'r newidiadau arfaethedig i wasanaethau vascular yn ne-ddwyrain Cymru. This paper seeks the board's endorsement to a period of region-wide engagement on proposed changes to vascular services in South East Wales. The future sort of configuration of vascular services is important to look at, because there is a need to stabilise the service in a number of key areas of fragility. There's been a long history to the development of these proposals, and enclosed in the papers are the engagement document, process, timeline and the case for change. It sets out why currently the service needs to be reviewed due to growing demand and need for the service services, and also the need to actually reconfigure so that the services can meet quality standards, and also it sets out some of the issues around difficulty in getting and keeping the workforce it needs to deliver, because services are currently spread too thinly. So the proposal around engagement is around achieving better patient outcomes, and it's proposing a preferred way forward of a hub and spoke model, which is sort of in line with how the services have been working over this period of time. And an example of that would be there's already strong joint working and an out of hours rota arrangement for vascular services across the region. So given the range of services provided in Cardiff, and obviously it has become the major trauma centre, there's codependencies with interventional cardiology and cardiothoracic surgery. The proposal sets out Cardiff as the hub, and the spokes will be Llandoch Hospital, the Royal Glamorgan Hospital, the Grange Hospital and the Royal Gwent Hospital. I think it's important to note that in the proposed models that the majority of pre and post-operative care, including rehabilitation, will continue to be provided more locally across local hospitals within the region. The engagement involves all of the 4 health boards, so that's Aneurin Bevan, Cardiff and Vale, Cwmtaf and Powys, and there is a joint executive board in place that oversees this work to be delivered across the region. You'll see in the papers that the change impacts the South Powys population, around about 40,000 people who are served by this network of vascular services, and we've set out that would equate to approximately 33 cases procedures in 2019 as an example of the scale of the change for our population. Pathways for the Powys residents served by Hywel Dda and Swansea Bay remain unchanged by this proposal, and just wanted to note that the CHEs have been working on a national basis. They had a meeting on the 13th of January and has been supported by Cwmtaf and Aneurin Bevan Community Health Councils through that meeting, and there have been really local discussions taking place with our CHC in Powys through the CHC Services Planning Committee, but also I know the CHC have considered this engagement in their Powys Executive Committee. So it is important. We're working to, the ask is to agree to the timeline of this engagement, and we will work with the CHC locally then on the basis of the board's approval to develop a proportionate approach to engagement locally. It should be noted that we've talked about why some of the Powys information is as it is in the engagement report, and some of the issues that we have around that data going forward locally. And again, we will continue to just reassure the board that every patient that has access to service or is waiting for this service will be contacted directly by each provider to provide a view and to be part of this first stage of engagement. And obviously we've also noted the timing of this engagement during a pandemic. It's not ideal, but clearly as a region there is a view that we need a timely outcome to address the current service pressures. So the attached papers provide the detail on the engagement timetable, the documentation and the process, and the board, we would like you to consider the proposed focus of the engagement and also to support the start of the engagement and support the decision that we will receive the outcome of the engagement back to the May meeting of the board. Thank you, Chair. Happy to take any questions.
Are there any questions, please, for Hayley? If so, please speak up.
Chair, there was one that I wanted to raise in terms of observation and question.
Right. Go ahead.
Thank you. We'd say it's a very interesting report, because certainly something that I didn't understand in terms of vascular services and the sort of complex web of what it actually does comprise. So from my perspective, it was very interesting in terms of information. Not having some of the background to this and the sort of experience of early days, one thing that struck me was that Powys wasn't actually described specifically within the hub and spoke model. So I understand, you know, we don't have DGH and the acute facility. But in terms of rehabilitation, is there an opportunity for us to become part of that service in a more formal sense?
Yeah. Chair, would you, I'll come back in. Yeah, so Mark, I think that it would be fair to say that the document currently describes the changes to the acute phase of the hub and spoke model, and I think that will probably be quite helpful for us to, when we're doing the engagement, to clarify the arrangements we've got in place locally within Powys. So I'm happy to pick that up as a suggestion around how we can get that across more strongly. I also note there's a comment from Ian on the side around why we've got a problem with the information in the inpatient procedures coding position. That's partly to do with the level of detail that we need to pull off in order to understand those patients that will be affected by the changes to the hub and spoke model. But we will continue during this engagement period to try and get better information to support the next stage of decision making back in May. But just want to recognise what we're starting at this stage is the first stage of formal engagement. It's not the consultation stage. So there's an ongoing piece of work which I've discussed with the programme director of this piece of work around how we can improve the information that gets back later on in the programme once we're able to gather insights from the local communities and the public, but also to make sure that we've got a bit more information to offer to support the decision-making process.
Thank you.
Chair, I think Dr. Paul Buss has indicated as well to speak.
Okay, thank you, Paul. Do come in.
Oh, look, thank you, Chair. Look, the concept of vascular networks is basically that if you have networked arrangements, you save lives, and that's for sure. And the work from Getting Things Right First Time in England showed that that's so. The current networks operating in England are showing some really great outcomes. But I think that's a great question. I think going forward, Powys will get more involved in this from the primary care and community angle, because whether you look at strokes or TIAs, or whether you look at abdominal aortic aneurysms or blocked arteries, the genesis of them is hypertension, diabetes, lipid control, and I think that's our strength. So I think from a community angle, we need to be in there, we will be in there, and I think that's the future of actually starting to get better outcomes of vascular care, is actually doing the clinical work right up front in the community. So that's our strength, and we will be in there.
That's excellent. Thank you, Paul, for that contribution, because as you say, that is what we are good at in Powys. So thank you very much for that. Well, if there are no more comments or questions, is the board content to endorse a period of region-wide engagement? And remember, this is just engagement at this stage on proposed changes to vascular services. Yes, thank you very much. So that leads us into the next section of the agenda, which has items for discussion. And again, I think, Hayley, it's a good thing your dog is now quiet and your doorbell is no longer being rung, because I think this is you again. This next item, planning performance update.
Thank you. Diolch Cadeirydd am y cyfle I gyflwyno adroddiad i roi gwybodaeth diweddaraf i'r bwrdd am cynnydd yn erbyn cynllun diogelu'r gaeaf yn ystod chwarter 3. Yes, there are 3 reports that are in this pack. The first report is our progress against the winter protection plan during quarter 3. This report provides our update against the 4 harms that we were working to, that framework from Welsh Government, and also reflects key achievements as both the provider and as a commissioning organisation. The board will note that we've had a clear framework in place to manage our delivery against the winter protection plan, and I'm not going to attempt to try and summarise the report. You'll be pleased to hear, board members, but I just wanted to sort of say that this report is sort of work of all of the organisation, and it covers COVID itself and sets out our progress with the local arrangements that we have in place for testing, contact tracing, incident management, nosocomial processes and systems, as well as mass vaccination. And we're really making good progress, steady progress in delivering the prevention and response plan for Powys. I think it's important to note that there's significant attention that the organisation and the operational teams have had to maintain managing demands during winter. So our normal business, non-COVID business around unscheduled care, supporting management of demand to district general hospitals, and also supporting patient flow, and a continuous focus on essential services and delivery of planned care services. And the future report, the later report, the performance report, gives us the latest position on performance around that. Just wanted to also reference the work on the overwhelmed NHS and social care system, and in particular the workforce planning and the digital rollout has been really remarkable over this period of time, and significant progress has been made and ongoing focus and activity around this work. Again, in terms of working in partnership, I wanted to highlight the work around safeguarding and to reassure the board the continuous focus on safeguarding throughout the pandemic, and also the board will have had previous meetings, reports on continuing to try and progress the North Powys Wellbeing Programme during this time, and also the work that was done to respond to the earlier opening of the Grange during Q3, and that work is ongoing too. So I hope this report gives a summary of the achievements against actions in Q3, and happy to take any questions of my executive colleagues, who I'm sure will support if you've got any queries on that. Chair, shall I check? Would you like to just introduce the other two at the same time, or do you want to take them one at a time?
Well, perhaps one at a time quickly, if there is any comment that anyone would like to make, or a question. It's very good to know that safeguarding, which is a big issue during the pandemic, is sort of being monitored. That's the best thing we can say. And I know the local authority is very much involved in that. Yeah. Well, I don't think there are any questions, so yes, please do move on, Hayley.
Sorry, Chair, I'm not sure if it's appropriate there. I just had a question on the performance table in terms of the second one, which was number 17, GP access. I don't know if that's appropriate to ask it now, or...
I think you've gone ahead to the next paper.
Oh, I'm sorry, I'll come back when it's ready. Thank you.
Lovely.
Okay.
Shall I do that
Yes.
next, Chair, and then Jamie, you can perhaps come in and respond to the GP access question. So the performance report, we still aren't back to our full integrated performance reporting during this time, in the sense of we've got a summary performance report included. Carol's already covered earlier around the position on some of the COVID position that we're facing, but just to give you the latest figures, our rate per 100,000 within the last 7 days now today is 108.73, and the latest available position around residents who have had a positive test outcome in Powys is now 3,477, and sadly, again, in terms of the people who've passed away, the current figure in Powys is 190. So that's sort of a bit of more up-to-date information on that. On a summary level in the performance report, you'll see there are a number of areas that remain a challenge for us around the delivery, particularly around key performance, around waiting times. I'd like Jamie to come in, if that's okay, Chair, to just give you a bit of an overview. Although it looks like a deteriorating position, and it is in terms of the length of time that people are waiting as both a provider and as a commissioner, there are some good news stories in there around the work that's being undertaken currently as well. And I think particularly Jamie will want to just cover off mental health and essential services. And then the other element is perhaps just to focus a little bit on workforce, and it would be helpful for Julie to come in. So perhaps I could pass to Jamie and he could also pick up the query from Mark around GP access. Is that okay?
Thank you.
Yeah, very happy to. Thanks, Hayley. Thanks, colleagues. Yeah, I think I'll try and preempt Mark's question, but I'll clarify it when I get to that point. But thank you. Yeah, clearly we would all wish that the waiting times presented here were shorter. But the teams in Powys as a provider are doing all that is possible to minimise these waits, bearing in mind what are unprecedented prevailing conditions within which we're operating during the pandemic. Members will recall that in previous updates we've outlined the services which have commenced or recommenced under the Essential Services Framework, and this paper reaffirms the details later in the section anyhow. Clinical teams continue to monitor referrals and clinically prioritise the referrals and the waiting lists. I would want to assure members of that. If I talk about things like planned care, outpatients, therapies, endoscopy, etc. Planned care in theatres wise is still sadly running with about 60% of our capacity due to the shielding issues with our staff. But however, behind that statistic, there is some progress. We've got a new Band 6 team leader has commenced. We've got a new ODP, that's a practitioner that works in theatres, operating department practitioner, starting in March. We've got a new senior nurse for theatres and endoscopy who starts next week. These roles will be key in the short term, but also to help us to develop and deliver our recovery plans. So there's positivity there that gives me confidence of how we can move this forward for our patients. As you know, we've been prioritising eye surgery in line with the framework and cataracts. But as opportunities have arisen, we are doing additional lists in orthopaedics for clinically urgent patients, and we'll be undertaking some general surgery local anaesthetics in Llandod in February. Every opportunity we can to get lists done, we are doing that. I want to assure colleagues. We're also doing some 3-session lists. Those are quite rare. 3-session lists, long days in orthopaedics in Llandod as well. And we're doing our best to try and clear some of our sections of our waiting lists to the waiting time targets. Things like upper limb, hopefully we can get that sorted by March. In terms of cataracts, we are planning we'll have no one waiting over 52 weeks by March, and working very hard actually, colleagues, to get to 36 weeks. Endoscopy is well placed. You'll be aware that we turned that service back on in line with guidance as soon as July. We are up to date on our urgents and our urgent suspected cancers. So actually, again, that's positive assurance that those patients that clinically need to be having their scope are being done. In terms of outpatients, we have more additional appointments. We've got a senior nurse for outpatient department across Powys coming in. We've appointed a new eye care nurse who's a trained injector. So in a prudent way, we'll assist in managing our eye care patients and recover our previously very high level of eye care measure performance. Our wet AMD service, of course, colleagues will note, is in place fully and has been throughout COVID. In-reach service, as we call it, services and support from colleagues across from the borders that come in, as surgeons particularly, is carrying on. For clinically urgent patients, they're coming in, doing outpatients and surgery where it's possible to support those patients. So I wanted to highlight that whilst the number of patients who are waiting for care in Powys is clearly high through this COVID period, I wanted to add that context to it, as Hayley says, that we are seeking to improve that at every opportunity. Mental health, Hayley mentioned, the report highlights it. I think it's pleasing to see that we've hit the targets on part 1 and part 2 measures. I know we discussed this at a committee in the past, and I was able to confirm in the last EQS we would be hitting that target. I'm pleased to see the paper now reports that we have hit that target, so that my assurance to people like Trish was that we would get there, and we've got there. So that's pleasing to see. I think Alison might want to comment on the really positive outcomes of the school nurses and the health visitors of the children's nursing team on the flu vac as well. If I then move to preempt to Mark's question. Mark, I think the comment is on the paper. I'm looking for the page now. It's page 10 of the actual printed paper. This is a measure around access, and there are multiple strands to that measure, measure 17, about 8 different subsets to that. The most commonly noted ones are how quickly they answer the phone. Is the most common understanding of that, but it's wider. It includes an access survey, it includes availability appointments. So that is the measure that's in place. A lot of work to be done on access at the moment. We have an access forum in place still, and it has been a challenge and a different way of working. I noted that the CHC have just done a recent report that we've received on the patient's experience of access in general, particularly using technology. So I'm aware of that measure, Mark, but also Welsh Government has in the past few weeks allowed some of those subsets of that measure to be reduced. So, for example, we will not be required to do an access survey this period. So, what was your particular question, Mark? I'm sorry, but I tried to preempt it as best I could.
Thank you, Jamie. Yeah, we've had a number of helpful reports, I think, from yourself and your team, the performance and resources, and also yesterday, an internal audit report regarding this subject as well. And what I was or the impression I gained from the previous reports don't quite chime with what I'm seeing in this table, as I would have thought that the performance would actually be higher, because the reports I've seen previously were much more positive and showed enormous growth or performance over the last year, and wondering whether this was a consequence of just timescale.
Yeah, I think it is definitely a consequence of reporting periods, Mark, I have to admit, and the availability of data. So our next Access Forum is actually in April. So we'll be working on that, and the reports like that will come through to probably either PNR committee or EQS, probably is PNR committee, I agree, Performance Resource Committee. So it's more of a timing issue at the moment, Mark. Yeah.
Thank you.
But I'll make sure the detailed updates are provided to the committees as and when available.
Thank you. Did anyone else have a question?
Oh, it's Trish here. May I ask a question, Viv, please?
Yes.
It's in respect, I did note the improved performance in mental health, thank you. But I was wondering about the measure related to the GP diagnosis of dementia, and it has been a long-standing issue, and I just wondered if there's anything that we are doing to encourage that.
We carry on encouraging that, Trish. As you say, it is sadly a long-standing challenge. One of the issues we face is that it requires access to a CT for formal confirmation, and one of the comments from the GPs is that they don't always wish to ask a patient to travel out of county for CT diagnosis to confirm what they are sure is a dementia diagnosis, and they manage the patient accordingly. But we have a dementia lead in the system. There's work we're going to be doing with the RPB as well on dementia wider, and it is a conversation we will continue to pick up with practices, particularly as we now get hopefully towards the back end of our COVID challenges in the coming weeks and months.
Okay, thank you for that. I do understand a bit more about it now. Thank you.
Thank you.
Chair, should I come in to pick up on Jamie's prompt for the school nursing service?
Yes. Yes.
Thank you very much indeed. Delighted to share an element of good news. Essentially, as board members will know, the school nursing service are an absolutely essential aspect of our provider service in supporting the health and well-being of children and young people and families in Powys. Board members will also recall that a risk assessment was undertaken to help enable our school nursing service as experienced vaccinators to support our mass vaccination programme. Notwithstanding that, we've received some data that shows that the uptake of the influenza vaccination for flu in the school age population aged between 4 and 10 years is just shy of 80% across that whole age group, and is actually the highest uptake in Wales. So I think I'd really like to take this opportunity to thank our school nurses for their contribution, not only to the health and well-being, safeguarding of children and young people in Powys, massive vaccination, but flu also.
Okay, thank you very much, Alison. Well, thank you for those. We have noted those. Thank you very much, everyone who's spoken. We're so, at the moment, preoccupied with the present and present concerns, understandably, but we need also to plan for the future, in which there may or may not be an election to the Senate. We hope that there will be, and that I understand is the priority, but who knows? There's so much uncertainty. But can we turn to our own annual plan, please?
Diolch Cadeirydd am y cyfle i gyflwyno adroddiad sy'n disgrifio y ffordd i ni yn datblygu y cynllun blynyddol. Yeah, this report sets out the Welsh Government requirements to how we need to develop our annual plan for the next year. This plan will be coming back to board for approval in March. The NHS annual planning framework was published by Welsh Government in December, and a number of ministerial priorities are set within the report. support, for example, around prevention, reducing health inequalities, primary care, mental health, timely access to care, decarbonisation and social partnership. There are key enablers within the framework that we will need to address, and that's around workforce, new technologies and ways of working, finance, regional working, partnership working as well, communications, engagement and research and development. I just want to reassure the board that when we saw the national planning framework, that I think we're in a strong position to develop the annual plan, because there's a very clear alignment between not only the quarterly plans, which has been the sort of foundation by which we've been building our response during this year, but also with our longer term planning planning approach that we had in place prior to the pandemic that was set out within our integrated medium-term plan. We set 13 strategic priorities for the as a board earlier this year, and I think it's about further building on those with some additional areas of focus to enable us to plan ahead into the new year. The board will be aware that we have a new socio-economic duty coming into force on the 31st of March, and we'll also need to clarify in our annual plan how we will address this. The paper summarises the 6-step approach to planning ahead, and that is very much the approach that we've been taking during this entire period, but particularly in the context of the annual plan. We will need to start with assessing and building our plan on the basis of what we've learned and the reflections over the last year. There's a significant amount of work being undertaken to look at the latest evidence so that we can assess our position, understand need, and particularly understand the scale of the challenge that we'll be facing around access to health services going into the new financial year. And there will be key issues and critical priorities we'll be needing to identify within the annual plan that also address the corporate risks that we've identified during the year as well. Key theme of the annual plan will be about our need to recover and respond from the pandemic, but also we will be continuing to deal with the rollout of the mass vaccination programme, as well as the COVID itself response set out within our prevention and response plan during the beginning of this next financial year as well, and probably for a large part of it. So we have a plan, sort of project plan in place around how we're going to get this plan developed over the next 6 weeks to bring back to board for approval in March. It's a significant amount of work, but I think it's building on what we've already done, and actually it'll be important for us to reset those priorities going into the new year, and with that longer term eye to where we were setting our sights, which is our long-term health and care strategy. So, you know, I think we've made a lot of progress, a lot of work under train, and I know we've got some development sessions and engagement sessions to discuss this work over the next few weeks as well. So that's a quick summary, Chair, of the paper. Lots of work to do before now, the end of March, but you know, confident that we'll all wrap around this to make sure that we are clear about the plan going into next year. Thank you.
Thank you. And we have but I think really we need to look forward to seeing the March papers. As you say, an awful lot of work to do before then, but anytime there is a little moment or two for a quick question if anyone would like to ask. No? Okay, thank you.
Chair, I think Cal would like to come in.
Yes, I have to apologise. I can't read.
I apologise.
Yes, that's fine.
My mute button keeps getting stuck, so maybe that's deliberate. But just to say, I do think it's a really important time for us to try to lift our heads from the here and now into what's likely to be, or we hope, is a year of transition through the pandemic and beyond. And the pandemic will have left us with a different set of challenges and opportunities as well. So we do have a development session, as Hayley said, in February, so for board members to come together, and there are a number of pieces of work that underpin that. And that new legislation as well in terms of socio-economic duty. And if I can just draw in the issues of the wider issues of economy, both in relation to the impact of the pandemic, but also the changes in leaving the EU as well, which we'll need to understand both the positives and the negatives in relation to that. So I just wanted to underline how important this was for us to lift our head up, and I'm grateful to colleagues for pulling that paper together. Thanks, Chair.
Thank you. Yes. Any questions or further comments?
Yes. Chair, can I just sort of acknowledge? I mean, we've just had, the planning and performance updates and the annual plan with it, and I just want to acknowledge the significant amount of work that is. And Carol's sort of alluding to sort of like, as a board now being able to actually lift our heads up a bit. I'd say that we've been doing some of that right the way through, and it's just in recognition really of that, just to sort of thank the directors at this point, because I'm aware that it's not, and the cascade of work that's come from underneath that because of it, that's enabled us to sort of start to be able to lift our heads up and even see into the future from this point. And I know it's significant, and I know that we've got a lot of work to do with the work we haven't been able to achieve through this year, and catch up, and the impact that the pandemic's had. But I think that we're in a good place at the moment for going forward, and I just think it needs acknowledging, because it's just been quite an amazing year in many ways, as well as an awful year. Yeah, so I think it's worth noting.
Yes, thank you, Mel. We will be able to hold our heads up, and as I said at the staff recognition event, when our grandchildren ask, what did you do in the great pandemic? We will be able to say that we did best, and we made the best contribution we could by working hard. So thank you for that acknowledgement, and we're all aware of the amount of work.
It's very humbling, isn't it? Thank you.
Yeah. Okay. Well, thank you for that. We've received that, and we'll obviously be doing further work on it. So can we go on to the financial planning and performance, please? And that's agenda item 3.2. So over to Pete.
Thank you, Chair. So we've got the usual finance report included in the papers. If I just go through some of the key messages and at a high level, and then pick up any questions at the end.
Yes, that's fine.
If I take you to page 2 of the report, so this is a report as of month 9. So against our revenue position, we had an underspending month of 189,000. We're now £8,000 overspent for the year to date, and we continue to forecast a year-end position of break even. That includes that the full cost of our COVID response will be funded in full. Against our capital resource limit of currently 3.1 million, that is subject to be increased because we've got some additional funding in relation to our COVID response. We've currently spent 1.9 million against that plan, so we're on track to deliver against our capital programme. And currently, we're a little under target in relation to our public sector payment policy. If I'm going to take you on to page 8, this gives our current forecast of our total costs in relation to COVID. As a reminder, this includes both our direct and our indirect costs. This total cost is currently 28.4 million. As a reminder, that will include both our costs and our local authority partner costs in relation to TTP. It includes an estimate of the costs in relation to mass vaccination, but they are subject to change. We're still working through our final model based on the plan that we went through earlier. And a new item that's now included is a provision in relation to annual leave. Given the recent times, it's likely that staff will have annual leave outstanding at the end of the year, and we need to reflect that in our financial plans. This is all assumed to be funded in full as part of our forecast. And then the final page, just to alert you to, is page 10, which highlights our risks and opportunities within the plan. Really just to flag against the opportunities that as we move towards the end of the year, depending on the level of extra surge capacity that we may or may not need to open, this may create an opportunity in terms of the funding that we built into our plan. What we will do is we'll manage these opportunities against the risks that are included in that table to ensure that we deliver a break-even position. The usual monthly monitoring returns and papers are all included in the pack, but happy to take any questions.
Are there any questions, please? Do shout, because I can't see the sidebar.
I can see Tony would like to ask a question, Chair.
Yes. Okay. Oh, yes, I think I can now. Yes, do please come in, Tony. Are you on mute, Tony?
Yeah.
Or muted now?
Yeah, I'm okay now. Can you hear me?
Yes.
Yeah, it was just one point of clarity, Pete. On the finance performance report, page 11, it says that the first bullet point is overspend of 8,000, which is immaterial. It then goes on to say on the fourth bullet point that the health board has assumed £500,000 savings against a target of 5.6 million. And then the shortfall in that is going to be met from COVID funding. I don't quite understand that. Perhaps it's my simple mind, but if we had a target of £5.6 million worth of saving, and we've only achieved £500,000, 5.1 million short on the savings plan. But as you read on that bullet point, it seems that missed savings plan is going to be mopped up by COVID. Could you just clarify that? It's probably my ignorance of how the system works, but it didn't read right to me.
Certainly, Tony, not a problem. Thank you for the question. So if I just take you back to page 8 in the report, the grey table included in the report, that is really detailing the full impact of our COVID response on the health board. As I alluded to, this includes both the direct costs, and the indirect costs of COVID. So we have our direct costs in terms of additional capacity, additional resource being deployed in relation to the extra services being provided, but there are also indirect costs. They include areas such as the block contract arrangements we have with our secondary care providers, and also the impact on our ability to deliver savings. Some of those are linked again to the block contract arrangements, as we may have changed patient pathways, but we can't actually release that funding. And also, understandably, given the focus of the organisation staff on delivering against the pandemic, which has taken away that ability to release some of the savings that we'd had targeted and planned. So in our total cost of COVID, as forecast there in the current 28.4 million, including the areas which are estimated at the moment, it includes that indirect cost in relation to the non-delivery of savings. And that currently is the level of funding that will be covered off in our plan.
Oh,
Does that answer the question, Peter?
Yeah, I understand the explanation. I didn't understand it from the written version, but now Pete has explained it more in layman's terms. I can follow it, and thanks for that, Pete.
No problem, thank you.
Question. It helped me as well, Tony, because I was a bit bemused, I must say. Thank you.
Okay.
Are there any other questions? Yes.
Viv, it's Trish here.
Yes, come in, Trish.
Chair, if I might ask, and again, it's probably my ignorance, but on page 9.5, it talks about in-year operational pressures, and could you just clarify how, if we're going to maintain, assuming current patterns of expenditure into Q4, how we can predict a balanced budget?
So thank you, Trish. At any point in the year, obviously our forecast is based on a number of assumptions that cover the future months planned activity and costs, and based on that forecast, it assumes that we'll be delivering against our plan in terms of level of service provided, an operational level. And as I alluded to, the risks and opportunities are where we're flagging any potential deviation or variation from that plan. And those are the areas that we focus on, that we have to manage to mitigate any potential risks, to crystallise any opportunities, to ensure we deliver our balanced plan. On page 9, and I know this is a regular part of the report, and apologies, I know we've picked it up in previous boards, but happy to go through again. Page 9 is really just describing how our whole total financial forecast fits together. So just without going into a lot of detail, but I can if needed, on that page 9 and the table on the left hand side, that really tracks through our current financial plan forecast, starting off with our original INTP plan, which had a minor surplus of £21,000, picks up then on in-year budgetary pressures, opportunities and spends, adds in risks that we've built into our forecasts, adds in the opportunities that we may have from slippage against certain spending plans, slippage against funding, in-year operational pressures, some minor technical adjustments, and then the whole COVID-related expenditure and funding assumptions. So at the highest level, that is how our plan knits together, and that's what we're tracking on a constant basis and reporting against to make sure that we're on track. Does that help?
That's really helpful, thank you. So it's a composite of all of those elements working together that enables us to predict a balanced budget.
Yes, exactly. So that's exactly it. Keeping all of those together, picking up any areas of variation against each individual area, bringing it together to our overall financial position. And as I went through, apologies, I do focus on the absolute highest level and then take the questions, so I can pick up on these areas in a bit more detail going forward.
I don't think it's necessary. I just needed the clarification. Thank you.
Thank you.
Are there any more questions?
Yes, Chair, please, could I ask a question? It's a question really for our Director of Workforce as well as Pete, because I'm conscious that this would have a financial impact, but will staff be able to carry forward at least 1 week of annual leave into the new financial year? Because it really is very difficult for staff whilst they're working such long hours and under such intense pressure to take annual leave.
So shall I go first on the financial side of it and let Julie come in? Is that okay, Julie? Susan, thanks for the question. Again, as I very briefly alluded to on the page 8 of the table, identifying the total cost of our COVID response, direct and indirect, a reference to the new line in there, which is the annual leave provision figure. That is recognition of the exact point you've just made. So we're recognising that people will not be able to take all of their leave potentially without going into the full accounting regime. There is a need to recognise that as a cost within our books and in our position, and that is where that reference is made. In terms of the actual workforce side of it, shall I hand over to Julie and then we can both come back on any further questions?
I think
you're on mute, Julie.
We can't hear you, Julie. You stuck on mute. Oh dear.
So I can come in if try and come in on that. So basically, what we've done is we're trying to work through and understand what potentially would be the level of untaken leave that people may have, and working through that framework in terms of what that may mean, so we've got some sort of control on that. Of course, we want people to take the leave, we want them to be able to have their downtime to be refreshed given the current pressures that everyone's been facing to maintain their well-being, but recognising where that's not possible, we look to recognise that annual leave, and we're talking about a framework of up to 10 days depending on different areas, different circumstances, and obviously some level of control for each area.
Okay.
Does that help, Susan?
Yeah. Yes, thank you very much, that's very helpful.
Julie, did I cover everything for you? Can't see a nod.
Thank you.
Thank you.
Well, it's unusual for Julie to be quiet, I must say.
Yeah, and just to add, Chair, as a note aside, but yeah, that has been agreed via our exec gold committee.
Okay, thank you.
Oh, excellent.
So if that's everything on that point, can we move on to the next item, which is the allocation letter?
Yeah, thank you, Chair. So this links very much with the annual planning framework, the item we went through previously. This is really to give the board some sight, and we've received our allocation letter just prior to Christmas, which sets out the funding to be allocated from Welsh Government. This is our baseline funding. I've included all the relevant tables by expenditure area and service area within the report. I won't go through them line by line. I think the key thing to flag is that the total revenue resource limit baseline figure for the Health Board is now 323.7 million, so just shy of 324 million. I think the key things just to flag is that they're included on page 5, that there's been a general increase uplift of 2%. For Powys, that's circa 4.6 million. The funding allocation letter so far excludes the ongoing response to COVID and any additional activity and resource needed in terms of our recovery from COVID. Just to flag, there's not yet been confirmation of uplifts in relation to primary care, and that will be to follow. And currently our discretionary capital allocation remains at the 1.4 million that it's been for a number of years. The other part of the paper just to flag is that on page 6 it really just gives you a timeline of how the financial plan based on the allocation letter will be developed in support of the annual planning process that Hayley has already described. And also in the appendice there's a paper that's been approved by the exec team about how we go about our budget setting principles. And the thing to highlight in here is that we're completing an exercise to make sure we realign our base budgets to recognise where our historic expenditure trends and patterns have been, to really just improve their accuracy and make sure that our resources are allocated to the right areas as per our services being delivered. These will all be taken through the usual board and committee process as we lead up to the annual plan coming to board in March. Happy to take any questions.
Okay, thank you. Any questions? Okay. Well, thank you. I think we've covered everything reasonably clearly. I'm very pleased to say I now understand it all. Not being from a financial background, some of the things are quite, and especially the complexities because of COVID. But thank you very much. Could we then go on to agenda item 3.3, the post-COVID syndrome management pathway? So Claire, I believe that's you.
Yeah, thank you, Chair. This paper is just to inform the board the Powys response to long COVID syndrome or COVID recovery, as we're calling it, and it's just to update the board what we've been doing. So Powys has been very involved in the national work in response to COVID, being involved in the pathway work nationally, which we refer to in the document. Also in the NICE guidance publication, we've been involved in steering that as well. And the paper just outlines what we in Powys will be doing in response to COVID. Post-COVID syndrome's defined as somebody with symptoms after 12 weeks of recovery from the illness. And that's can be a wide-ranging presentation, can be different symptoms and different severities. We don't know yet what the numbers are. And as this is a new disease, we don't fully understand the implications, how long it will last, or any of those issues at the moment. So what we do know is people respond best to understanding their condition and also to a multidisciplinary approach. We have a lot of experience in Powys of managing people with post-viral syndromes, and that's the reason we've put our service through the pain clinic and long post-fatigue syndrome service, because they have this skill level already. So the paper just outlines what's available. On the 20th of January, an app was launched which people can access if they search COVID recovery. It's on both Apple and Android services, and that's for anybody who's had COVID. That will help them understand any symptoms they may have and what they need to do ongoing, and that's available to everybody now. And we've also started to see patients through our own services that GPs are already referring in. So we're just starting to put information out to the public about the app now, and also we've spoken to GPs of how they can access the services in Powys. We've designed an assessment form that helps to screen people and understand if they need ongoing assessment, or whether they just need to understand that this is a fairly long process of recovery and the things they can do to help themselves. So hopefully everything is explained in the paper, and I'm very happy to answer any questions. Thank you, Chair.
Thank you, Claire. It's a very clear paper, so thank you very much. Are there any questions, please? Okay. Carol? Yes, thank you. Mel first, then Carol.
Thank you, and thank you for the paper. Mine, I suppose, is about we don't know yet the full impact that post-COVID syndrome will take in Powys, and we don't know how far. It's really about the expansion and the flexibility within the service to be able to grow in response to need, I suppose, going forward, as that's identified and as it becomes apparent, and the position around that, really.
So thank you, Mel. So we have agreed some additional staffing to support the screening of these people and provide advice and guidance. And what we've done is we recognise the core services that these patients might need support from. We're certainly seeing most of these people needing mental health support, so we can be using our Silver Cloud service. Lots of people are suffering from anxiety and fatigue, and they can be supported in our fatigue service. We see people with musculoskeletal problems. They can be supported by our musculoskeletal service. Neuro problems are rare, but we are seeing them. And of course, they're the respiratory and cardiac presentations we're seeing. So what we've done is work with our specialist areas to help them support the patients in our core services. And we will monitor those services as we go forwards. And obviously, we'll have to respond based on demand. But at the moment, it's almost impossible to predict. So it's a watch and wait and respond as best we can, I think, at the moment, Mel.
Thank you. Yes.
Thank you.
Carol.
Yes, thanks very much. It's just to recognise the leadership that Claire has brought to this, not just in Powys, but for Wales as well. And Claire has been the Wales representative into NICE consideration of this. So I think that's really strengthened our own position in developing this service. There was a lot of talk about specialist centres and that sort of thing, but you know, the real strength of our models in primary and community care, we hope will mean that support can come more quickly, because simply, you know, we just don't know, as many people have said, the numbers of people that may need to have some additional support here. So I guess, Claire, you know, we're outlining that there will be an evaluation and a further report, and we'll need to consider any further investment into this as the time moves forward and we become more aware of those longer term demands, really. So to thank Claire for the work that she's been leading in this area.
Thank you.
Yes, thank you. Well done, Claire. And, you know, complexity upon complexity. Has there ever been a more difficult time in the NHS in the delivery of care to our communities? Now, to a further complexity, the EU. Well, would you like to brief us then quickly? You have presented a paper here, EU transition planning update, Stuart. I think you're on mute still.
Sorry, Chair, can you hear me now?
Yes, yes.
Thank you. I'll just briefly run through the paper and then I'm happy to take any questions. The paper is obviously one of a series of papers that's been to board now, I guess, going on for probably about 18 months plus in relation to first Brexit and then EU transition. We're obviously in the position now going into 2021, where there is an agreement in place between the UK and the EU in terms of trade going forwards. I think it's probably the case to say that people are still reflecting on that deal to really try and understand what perhaps the longer term implications are for both Wales, I suppose, and for the UK as a whole, actually, in relation to trade and ways of working. So the deal has been agreed, but there is still some review of what the deal actually means long term, I think, for Wales and then for Powys as part of that. Within that context, where we are at the moment is we're very much in what I would call a steady state, a holding pattern. So we are still participating in the All Wales networks that have been established. So there is an EU transition senior responsible officers group that we're continuing to participate in and to attend those meetings, and we're continuing to escalate any issues that have occurred locally in relation to EU transition through local resilience forum arrangements. So there is a mechanism through the Powys Local Resilience Forum for us to submit on a mid-Wales basis any issues that have come to light around EU transition. And certainly from a Powys point of view, since that deal was agreed in January, there's been nothing specific that has arisen for Powys around EU transition. There has been, I understand, further across Wales, particularly in terms of Pembrokeshire and some of shipping coming across from Ireland into Wales, but specifically for Powys, there's been no specific impact since January. We are continuing with the position that we have held throughout at the moment of where it relates to medical devices and medicines, that we hold high average stocks of those devices, but we don't overstock. And in relation to medicines, the advice is still to prescribe as normally and not to change that behaviour. Similarly, then the other main area I think is probably foodstuffs and foods. As a health board, we're continuing to hold slightly higher than normal stocks. So as a health board, we have a store sufficient for probably about 6 weeks supply of main food types. So should we need to rely on our own storage facilities, we have about 6 weeks supply that would cover our hospital sites. And then obviously as you move up through the chain through Wales in terms of food supply, there are additional buffers in place there as well. So we're relatively confident around food, medicines and medical devices. I think probably just drawing it to an end, what I would say is I think we're probably in a position now going forwards where we will be shifting more towards understanding really what some of the long-term impacts of the deal are likely to be for Wales, and then for Powys as part of that, as Carol alluded to when we talked about the annual plan. I think what we will need to do locally is begin to get a better sense of what we think it means, perhaps more structurally and socially for the population of Powys as we go forward. And just a note on that, as reflected in the paper, Public Health Wales colleagues did do a health impact assessment of no deal Brexit some time ago, and they are currently in the process of updating that technical document to give a better sense, I think, of what the health impacts of the current deal are likely to be for both obviously the population of Wales, but within that also it will have issues of interest for us in Powys as well. So we're very much in the position at the moment where we're in a steady state. We're continuing to make sure we've got short-term arrangements in place, but we are in the process, I think, of shifting now more towards a more medium to long-term consideration of what the impact of the deal is likely to be for Powys and Wales as a whole. Thanks, Chair.
Thank you, Stuart. Well, now we are just about coming up to our target finish time of noon. So if anyone has a quick question for Stuart, could they please come in? Okay. I think there's so much to think about. We feel a bit overloaded at the moment with concerns, Stuart. So thank you very much. Carol, did you want to say anything in response to that, or are you content? Right. Okay, Camilla.
I'm happy to, well, and again, it's really important. If we hadn't had the pandemic, we would have probably spoken of nothing but exiting the EU. So the fact that we have been needing to keep a very close eye on that and do some work in the background has been a credit to people trying to make sure we're as prepared as we can be. And Stuart's absolutely right. It is now the medium and the longer term that we need to turn our attention to. So thank you, Stuart, for your leadership on this.
Thank you very much. Yes, thank you. Now that completes section 3 of the agenda. Section 4, items just for noting. So are there any other matters of urgent business? No? Well, thank you, everybody. That does conclude this meeting of the Health Board. And we will have now to go into an in-committee session. So thank you, everybody.